In this video, I will be going over the ID list for the respiratory system. Let's go to Connect APR. Recall that your list is located here with the clipboard. If you connect on that list, the first structure is well, let's say I don't know how to pronounce it. I'm going to go over here, push on the I icon, push that.
Hoena.
And I get the pronunciation. So the choana. The choana are paired openings between the nasal cavity, which is located here, and the nasal pharynx. So it's an opening between those two, and they are paired because you have your nasal cavity divided into two compartments. The hard palate, recall, is the anterior portion of the roof of your mouth, and it's going to consist of two bones, an anterior maxillary bone and a posterior palatine bone. Remember from AP1 that the anterior maxillary bone, the portion that makes up the hard palate, is called the palatine process. Posterior to the hard palate, you will have the soft palate. There is no bone in the soft palate, and at the very posterior tip of the soft palate, you will have an uvula. That uvula will be used during your swallowing reflex to prevent liquid and food from going into your nasal pharynx. Let's look at the pharynx. The pharynx is the tube that runs posterior to the nasal cavity and the oral cavity. The nasal cavity is this portion here, and we'll look at the boundaries of the nasal cavity in just a minute. The oral cavity is going to be located here. This is your tongue. You can see your teeth right here and your labia or lips. Next week, or when we get into the digestive system, we will be studying the oral cavity. Let's go back to the pharynx. The superior portion of the pharynx that is posterior to the nasal cavity is called the nasal pharynx. Moving inferiorly, the portion of the pharynx posterior to the oral cavity is called the oral pharynx. The inferior most part of the pharynx is the laryngopharynx, and posteriorly, it feeds into the esophagus, which is this tube here. Food will go through the esophagus as well as liquid on the way to the stomach. Anteriorly, it is going to feed into the larynx, and this is part of the larynx here. So let's look at the nasal cavity. I'm going to go back to that cavity. Along the lateral walls of the nasal cavity are three ridges. If you remember, the skull has three ridges. There's going to be a superior nasal concha. Conchae is plural. That's that ridge. Let's say I'm not sure how to pronounce concha. Again, remember, we can go here. We can learn a little bit about it. I encourage you to do this with every structure, and then I can
Superior nasal concha.
to get the pronunciation. Let's go back to the list. Inferior to the superior nasal concha is an indented area called the superior nasal meatus. The middle ridge is the middle nasal concha, and the indented space immediately below it is the middle nasal meatus, right in here. The inferior-most section there, or ridge, is going to be the inferior nasal concha with the inferior nasal meatus here below it. Let's look at the sinuses. There is going to be a sphenoid sinus there, located in the sphenoid bone. Here within the nasal pharynx, you are going to have the opening to the auditory tube. And the very entrance of the nasal pharynx, this little area here, is the vestibule, nasal vestibule. And you're going to have an opening there called the external nare. So that's the opening or your nostril. But on the test, you need to be sure that you call it the external nare. I want you to use the proper terminology. Let's go back here. Now, what we're going to look at next is your voice box or larynx. It will consist of 9 cartilages. 3 will be paired, 3 will be singular. All of them except for the epiglottis, which is this here, will be hyaline cartilage. The epiglottis is elastic cartilage. Again, I'll go to the eye icon. It's going to tell me that it is going to cover the entrance into the larynx during the swallowing reflex. So the larynx moves up. This will cover the entrance so that food and liquid will go into the esophagus and not into your airways. I believe that covers everything on this activity. Let's go to the second one. And the second one, we're going to be looking at your lungs. We're going to start with the trachea. The trachea is the tube between your larynx, your voice box, and the bronchi here, the primary or main bronchi here. Here you have your thyroid gland, which you learned last week. So here's the trachea. It is your windpipe. That portion of the trachea, which is where you have the branching of the primary or main bronchi, you're going to have a cartilage there, and it's going to be called the carina. Let's look at the lungs. Here is my left lung, and this is my right lung. With the right lung, I'm going to have 3 lobes. Separating the lobes are fissures. So I will have a superior lobe, a middle lobe, and an inferior lobe. The fissures, as I mentioned before, are separating the lobes. The fissure between the superior and middle lobe of the right lung will be the horizontal fissure, right there. And then in between the middle lobe and the inferior lobe will be the oblique fissure. So in this view, this right in here is the horizontal fissure, oblique fissure, superior, middle, and inferior lobes of the right lung. This right in here will be your diaphragm. Remember, everything superior to the diaphragm is the thoracic cavity. Inferior to it, you're going to have the abdominal cavity. And this right in here is your liver. Let's look at the left lung. The left lung will only have 2 lobes. It is smaller than the right lung because of the way that the heart is oriented. There will be what is called a cardiac notch, which makes space for the heart. Is this indented area in the left lung. You are going to have a superior lobe and an inferior lobe. Those 2 lobes are separated by an oblique fissure. So there is no horizontal fissure in the left lung. Let's go back to remember your trachea. The trachea will branch into main bronchi or primary bronchi. So you're going to have a left main bronchus Notice it's a little bit longer and narrower. And you're going to have a right main or primary bronchus. If something goes down your airway, it tends to get lodged in the right one simply because it has a larger diameter, shorter, and it's much easier for something to go into that. Let's go on to activity 3. This is looking at an anterior view of your larynx. Here is your larynx. This is your trachea. And this is your hyoid bone. So here is your trachea. Recall that the larynx consists of 9 cartilages, 3 that are paired and 3 that are single. The epiglottis is a single cartilage. It consists of elastic cartilage. So if I ask you on the quiz which one is elastic, it will be the epiglottis. In addition, you're going to have the large thyroid cartilage. That is a single cartilage, and again, this will be hyaline because the only one that is elastic cartilage is the epiglottis. You're also going to have a cartilage called the cricoid, which is a singular cartilage as well. In addition, you will have some ligaments that are going to be between different cartilages or a bone in a cartilage. So we're going to start with the ligament that is between the thyroid cartilage and the hyoid bone, and that is the thyrohyoid membrane. You're also going to have a cricothyroid membrane or ligament, and that is going to be between the thyroid cartilage and the cricoid cartilage. So the name is going to tell you where these are located. On the cartilage or on the larynx itself, on the thyroid cartilage, you're going to have an area here that is raised, and that's the laryngeal prominence. That is more prominent in males than in females after puberty. This is your larynx. This includes an anterior view of all the cartilages that you can see in your larynx. If we go back to the trachea, we're going to have cartilaginous rings there. They do not go all the way around the trachea. They are shaped like C's. So I'll show you a posterior view in a minute, and you'll see that they are not on the posterior surface. So these are the tracheal cartilages. They help prevent the trachea from collapsing. This is looking at a lateral view. Again, here is your trachea, and this is going to be the thyroid cartilage. So let's look at, here we've removed some of the muscles so that you can see deeper structures. There's the cricoid. So we looked at the cricoid, another view. Remember, we looked at it from the anterior view. You'll notice that when you get to the posterior side, it's going to get thicker or wider, I should say. There is the epiglottis again. The epiglottis covers the opening to the larynx. The opening is called the glottis. There is your thyroid cartilage again. And now we're going to look at your vocal folds, or sometimes what are called vocal cords. There are your true vocal folds, and your vocal fold is involved in voice production. Superior to that, you're going to have a vestibular or false vocal fold, because in human beings, it does not produce any sound. In cats, though, it is responsible for the purring. So again, the true vocal fold is inferior to the vestibular or false vocal fold. Let's look at activity 5. Again, we're looking here. This is going to be a posterior view, so let's remove some of the muscle. Here, we're in the trachea. You can see the tracheal cartilages, as I mentioned before, don't go all the way around to the back. So you're going to have that. Let's look at some of the cartilages of the larynx. There's the epiglottis again. There's the cricoid. You can see how it is thicker or wider in the back. We're also going to have some cartilages up here. We're going to have these larger ones here called arytenoids. And they are important in voice production. And on top of each arytenoid, you're going to have a little triangular shaped corniculate cartilage. So those are paired. So our paired cartilages are going to be the arytenoids and the corniculate here. And we are not able to see the cuneiforms, so they are not on. Let's go to activity 6. This is looking at a histology slide of the trachea. So in the trachea, and this is part of your respiratory tract, you're going to have the wall of that organ will have different layers. So we're going to start with the surface epithelium right there, and that is actually ciliated pseudostratified columnar epithelium. So if I go over here to the eye, it's going to describe it right here, what it is. Again, be sure that you read this. And then deep to that, as we're moving from the lumen is this part up here. So we're moving deeper. The next layer will be the lamina propria. And the lamina propria is looser areolar connective tissue that is immediately below your pseudostratified columnar epithelium here. And then as we continue downward, or moving out, I should say, this is going to be the submucosa of the trachea, and you can see there will be some glands there. And then the last layer will be the cartilage layer, and that's going to be hyaline cartilage. So if I remove the highlights, hopefully you can recognize that hyaline cartilage. The next activity is looking at a close-up. This is the ciliated. So here's the cilia, pseudostratified columnar epithelium. So you can see the cilia. You can also see these are the simple columnar cells, or the pseudostratified simple columnar cells. So you can see those there. And we're also going to have some goblet cells. Remember, goblet cells are mucus-producing cells. These goblet cells are producing the mucus that are going to be here on the surface. The cilia helps move the mucus, and they create what is called a mucociliary escalator, trapping anything, any particulate matter that gets through your nasal cavity. And then the cilia will move that mucus with the trapped particulate matter up to your throat so that you can swallow it, and it can go down into your stomach. And the stomach then can break down the particulate matter. Activity 9, we are looking at lung tissue here. So again, if I go up here, I'm going to be going through this. So this is lung tissue. What I want you to be able to identify are your air sacs, which are called alveoli for plural, alveolus for singular. So these are your alveoli. You're going to have what we call alveolar sacs, and notice you have alveoli that kind of open up into one another. So those are the sacs. You're going to have ducts. So I like to think of ducts as a little pathway that is created there in the lung tissue. It's as if you were taking a lawnmower and cutting through it. And then we're going to have a bronchiole. So this is a respiratory bronchiole. You can tell that this is a bronchiole because the walls are thicker here. This concludes this activity.